of all, palliative care is not hospice. A lot of times hospice is confused with palliative care, and in adults, palliative care is more like hospice than it is in pediatrics. The goal of pediatric palliative care is basically to support a family to make life easier and better for the patient and the family.
Palliative care teams include all different kinds of professionals and providers, chaplains, nurses, physicians, child life specialists, occupational therapists, physical therapists, and many other types of people. And the idea is that we come together and make one comprehensive plan about what a child needs and what his or her family needs. And then by communicating with one another, as well as the other specialists who help take care of a child, as well as their general pediatrician, we ensure that each child gets what he or she needs and each family is supported.
My name is Jessie and I was a patient at Children's Hospital.
My name's Nikki. I'm Jessie's mom, and I was here with her in the Children's Hospital in the 4 months that she was here. She had 19 surgeries because of necrotizing fasciitis. Because we had so many different doctors you know, taking care of so many different things with her kidneys and her ears and her belly, they were able to really get everybody together, like especially like when we were talking about putting a trach in. I was really nervous. Everybody had a different opinion. They were able to bring us all together, all of the doctors together, to help us get like a definitive answer as to what everybody thought. So they really helped in that aspect of like being more like our advocate as a family.
Our team takes care of children and their families who are dealing with several different kinds of things. Sometimes babies who are born very early and have complications from that. Some children who are born with differences in their anatomy or the way that their body is formed, so difficulties with their heart or their digestive system, that mean that they'll have to have a lot of medical procedures or different kinds of treatment. We can also take care of children who have muscular dystrophy or cancer, other illnesses that may cause symptoms like pain, where they may require an expert to help with their symptom management.
Being in the hospital has been an education for us because we're not doctors, we're not nurses, but when your child is in the NICU for a month and a half, you have to learn all the medical jargon and what they're talking about. And it was really helpful when Dr. Stroud could sit down with you and go over the results of a test and tell you what it really means in real people language. So that was really helpful to us. And then also telling us what's probably going to come next. They'll say, well, he had this test run, so I imagine the next thing they'll do is this. And this will be step 3 and 4 and so on. And so that was also really reassuring to know kind of what direction we were headed in.
When I was sick, I had a whole bunch of questions. Patrick helped me a lot and answer the questions I had.
Particularly for the pediatric palliative care program, my job as a chaplain is to come and to help parents and to help children sort through their questions of spirituality and faith that they have, and to help them to both understand their questions and also to explore their own faith to find some answers as well.
I mean, it's dad's worst nightmare to have a child that, you know, has all these issues going on. Everybody wants the perfect pregnancy and everybody wants the perfect child to birth and all of that process, but when you go into something that you have all this unknown, you have all this sort of fear and what can happen, yeah, it's very reassuring to know someone's on your side. And then also, you know, me and Jess as Christians believe that God does have it under control, but it's nice also to have sort of that spiritual support as well, going through with Patrick and someone you can sort of talk to about maybe what are your fears, what are you thinking, where do you want to go from here? So it's just sort of nice to have that support.
Right now our service is very young, and we are able to meet families and children when they need to be hospitalized for some reason. And that provides a great opportunity for us to meet them and understand more about their family, what's going on with their illness, and what things they might need. What we are missing is a piece that allows us to be in touch with them in between their times of hospitalization. What we're finding is that we encounter them in these times of crisis and are able to help them. But there is so much opportunity to help by coordinating their care and thinking proactively if we can see them in times between their hospitalizations. So what we would like very much is to be able to establish a clinic that is open to meet their needs in between their times of hospitalization.
I think with the present staff, we're doing about all we can for the inpatients, but to grow and to be able to offer outpatient services and somewhere down the road to offer home visitation services. This would make us really, I think, a great palliative care program, but without home visitation services, we can't furnish all the help that we think our patients need. I'd like to thank you for supporting Children's Hospital, especially the Pediatric Palliative Care Program at Children's Hospital.
Thank you for supporting Children's Hospital.
Thank you for supporting the Children's Hospital and little babies just like our Brian.
Thank you so much for your support and for being a part of the work that we do.
Thank you so much for supporting the Children's Hospital and taking a moment to learn about this program.
Thanks for supporting Children's Hospital.
Thank you for your support of such special children.